G'day, how you going?
I'll tell you, in treating patients with back pain, one of the first things I'll do with them once they're in the prone position is I'll run my two fingers down the length of their spine a number of times, trying to get an impression of any scoliosis that might be present. That is a curve running like so, but more so to get a sense of how prominent or non-prominent the spinous processes are. Often I'll come across a segment that feels relatively depressed, I mean physically sort of buried between the one superior and one inferior, and I'll press on it and the patient will wince, flinch or exclaim that it's painful. On this patient who we've been treating for lower back pain, there were a few areas which I attempted which were all negatives, except for right down the bottom, which is where we were treating at L5. As I push in there, that's perhaps a little sensitive on you, is it? Mm-hmm. Yeah. So that helps me focus my attention on a particular segment to decompress, which I'll do so through a number of exercises, but also some manual therapy. And cut there. One effective way to decompress the L4-5 or L5-S1 region is to put a broad contact on the sacrum, reinforce it with your opposing hand, and rock in a superior to inferior motion. Usually patients who feel overly compressed or impacted in that region, they'll really like this maneuver because it serves to unbend the hyperlordotic spine in a sense. So the lordosis here can be quite prominent on people, and we want to try and take that lordosis out, if not just for momentarily. And I'll mix in locating the L5-S1 facet joints. I'll reinforce my thumb contact here on the right L5-S1 and just push in a chordad direction, and then I'll jump across to the left side. So my left thumb is on the left L5-S1 facet joint, which is right about where the left PSIS is, reinforcing it with the heel of my hand, and again just putting some strong pressure. You have to take out the tissue slack as well. You have to really push force into that region, and from here I'm going to push even more and just get some feedback from the patient as to whether that's too much. Sometimes this can be quite intense. It can be painful, or it can be a sweet pain for them. They're like, yes, it is painful, but I really like it. I usually get people to rank it out of 10, where anything less than 5 gives me license to really go for it. If it gets up to about 8 or 9 out of 10, then I'll tend to back off and maybe just stick with rocking on their sacrum. Okay, lie face down for me. Well, Kit, you're due for some new shoes, mate.
Yeah, I nearly slipped over it on the way down there.
I'm not surprised. Far out. Have you seen how chopped up they are at the back?
Yeah. I was walking down the road with talking on my phone, and I nearly slipped over and dropped my phone on the way down here.
Is it wet out there?
Yeah, it just started raining a little bit.
Okay.
So yeah, they're definitely not wet.
So that's with the blocks in. So just having a look at your leg length here. So your right leg is quite noticeably shorter than the left, which I've told you before. And when I put you on top of the blocks, your legs are even.
Yeah.
And as you sort of lie on those blocks, your pelvis will slowly mould to that new position. And when I take the blocks away, we'll check it again. But your legs should be more even. Pretty much identical by the end of it. Okay, is that a bit sore in there?
Yeah, a little bit.
Yeah. Okay, and how's this one?
Yeah, a bit sore.
Okay. You're doing pretty well here. Like, those are only two sort of spots I can find on you that are really nasty. So this is a patient who comes to see me about once every 6 weeks. He trains somewhat regularly in the gym, and I feel that probably everybody under the face of the sun, regardless of whether they be extremely active or extremely sedentary in their jobs, should go and see some sort of manual therapist, because the forces that we subject ourselves to on a daily basis are such that it's justified to go and see somebody to decompress your body of all the build-up of those forces that are applied to your body, either from constant sitting and the force of gravity just squashing you into poor posture, or all the forces that you endure in training or sport. As you might have seen from other videos of mine, I like to do a bit of soft tissue work on the patient prior to adjusting them as a curtain raiser to the adjustment. Not everybody finds being adjusted as comfortable as others do, and so it just makes the adjustment that much more comfortable if we have warmed the tissues up a bit. Sometimes I'll do a bit of stretching, like you can see me here, stretching the quads. These are all parts of the body which may not necessarily be touched or stimulated when you're sitting at a chair, and it's good to wake up the nervous system in different areas of the body. And shortly you'll see me removing the blocks from underneath his pelvis and checking the leg length to see if the time he's spent lying prone on top of the blocks has been enough to passively mould his pelvis back into a more aligned position. Okay, magicals. You okay with this pressure?
Yeah, it's fine.
I want to adjust this patient's lower back, and he's quite a tall individual, and in my experience working with patients, I've noticed that tall individuals, there's a significant amount of compressive stress placed on the lumbar vertebra, and tall people can often be quite difficult to adjust. So, as with every patient, I like to do some soft tissue work in the area prior to adjusting them, and here you can see me treating his glute medius, piriformis and glute max muscles. This just makes it much easier to get a cavitation when adjusting people. And prior to doing that as well, you'll see me in a moment doing some active release technique on his left iliolumbar ligament. This is a really good maneuver to preface an adjustment because it really does increase the chances of getting an effective movement at the joint you're intending to adjust. I'll get you to lie on your right side for me. Okay. So just bend this top knee for me. Just shift your body over there just a little bit. That's it. Okay. This is like you're about to get adjusted. Okay. I just want to loosen up in through here. You seem to be a little tighter than usual. So you're going to start in this position. I'm going to have my thumb wedged in right down your lower back here, and I'm going to support your other leg there with my hand. You'll breathe in. As you breathe out, you're going to twist your upper body to the left side of the room. So you're going to use this arm to try and grab my elbow and use it to push against to help twist your upper body further around to the left, all right? So your body's kind of like a towel and we're wringing out the excess water.
Gotcha.
Okay, so I'm just going to pop a bit of cream on your back here. So we'll do about 3 of these, okay?
Yep.
All right, so breathing in for me, breathe out, twist back, find my elbow and push. That's it, perfect. Keep pushing and relax. Breathe in and breathe out. Twist back, just all the way back. Find my elbow. That's it. You might want to come around the back of your lower and have a look at the last one. So just straightening back up. Breathe in for me and breathe out. Twist back and push, push. That's it. Okay, and stay on that side. Could you feel that twist through your lower back there?
Yeah, for sure.
Yeah. So it just helps me butter up this joint here before I get at it. Okay, breathe in, breathe out. Okay, come on to the other side. It's pretty stuck in there, eh? Okay, breathe in, breathe out. Okay, line your back. Okay, just keep this arm nice and floppy for me. Any pain at the top there?
No, it's a bit soft though.
Okay, just tell me if it feels any different to this one.
This one feels a little bit loose right here.
Yeah, okay. Good. Okay, so I'm going to adjust behind your right shoulder here. Breathe in, breathe out. Okay, just relax your arms there. Okay, see how this feels here. Can you tell the difference there?
Yeah, but
Let's look at that left one. That one's definitely looser.
yeah.
Did you have anything go wrong with that right shoulder?
Don't think so. Oh,
Like an old injury?
actually, yeah.
What thickens?
I was getting pain between here when I was doing like bench pressing. Like in that sort of like that joint between what seems like the joint between the shoulder and the chest. Not sure if that's connected or not. But yeah, that's the only thing I can think of that was sort of a recent little niggle on that side.
What did Willie have to say about that?
Not much.
I'm also wanting to adjust the patient's neck, so I like to do some active release technique prior to adjusting. This helps to loosen off the tissues, free them of any adhesions within the muscles, and just makes for a much more comfortable neck adjustment.
But the other guys just kind of seem like boring. I don't know, it's weird.
Yeah, you need some personality.
Yeah.
Push your head against my fingers. And relax. And push. And relax. And push. Okay. Try and get this really floppy here. Okay, I'm going to get you pretty low down and through here, okay?
Okay.
This will be a tough one for me. Okay, you right through there?
Yep.
Right. Okay, you right there?
Mm-hmm.
One more. Okay. Just sit for me and face that way, please. Yeah. Okay. Just drop your chin to your chest. Just slouch a little bit for you. That's it. Breathe in. Breathe out. Breathe in. Breathe out. That's one. Okay. Hands on top of your head. Your hands on mine, elbows together, breathe in, breathe out. Are they all good?
Good.
Okay, come and stand facing the mirror for me. Okay, so bending forward as far as you can, and back up. Just raise your left knee towards your chest and down. Okay, let's turn your head to the right and to the left. Okay, there you go. So, thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate. Good on you.